So I am telling you, through you to my patients, if you are searching for any non-surgical treatment for any disease, just type IR. It's a interventional radiology. The short form is IR. You can search the disease non-surgical treatment for my fibroids, for my thyroid lesion, nearby IR to me. You can search it on internet. It's a so easy tool. You have to write it IR near me, or you can search non-surgical treatment by IR for this disease. So we are doing from FNAC, for diagnosing a smaller lesion in the body, from biopsy of a cancerous lesion to treatment of a cancer like liver cancer. We are treating fibroids, we are treating thyroid lesions, we are opening up the vessels, we are blocking the bleedings, we are treating the paralyzed patients, stroke patients within the time. So what's the patient have to do? You just have to search on the internet, is this treatment available by an IR, or this non-surgical treatment is available by an IR. Just have to search that. My simple message to my patient is, search for an IR nearby, go to the IR, go directly to that IR. So save the money of a middle doctor. If you are going to a physician, if you are going to a surgeon, if that disease is treatable by an interventional radiologist, we are not saying that we are 100% treating all the diseases of the body, no. But there are so many advancement happening so fast. It's like in a mobile phone, it's like in a computer. The generations are coming so fast. So that same happening in the interventional radiology. Our treatments are developing so fast that in last...
Sir, we are only treating everything. So all these treatments we do in consultation with our surgeons, with our medical oncologists, with other general practitioners. And then like for example, the tumor can be treated up to 3 to 5 centimeter by interventional radiology. But if it is more than that, or if it is straight to other places, we still need surgery. So we are not saying that we are competition to surgery. We are complementary to the surgery. As Dr. Yadav said, as Dr. Ajit said, that we are helping them out. For example, one big surgery is done and then patient again started bleeding. You cannot again open the patient. In such cases, we do angiography and stop the bleeding. Like for thyroid, generally for cancer, they can remove it. But after that, if again it comes, then patient cannot go again and again in surgery. So we are not claiming that all diseases can be treated by interventional radiology. The decision is taken by the group of doctors, and wherever it is suitable and scientifically proven that the safety and effect of the treatment is good for the patient, there we offer interventional radiology.
So you judge them what is available, sir?
To the patient without any risk or side effects, minimal risk, and patient focused, because it treats the patient in an integrated approach. Almost every organ of the body is treated by interventional radiology. We are patient focused. We treat from head to toe. Almost every domain of medical specialty is covered by interventional radiology. So this is the main focus of interventional radiology, and that's why we want the patient himself to be aware of it and approach us for any of the procedures.
One request about women in IR, how important it is.
Actually, we say women getting into medical specialty at high numbers, but only few numbers come into interventional radiology. Main reason is radiation exposure and pregnancy-related issues and work-life balance. But what I want to emphasize here is the fear of radiation has been misinterpreted. It is not so serious as has been portrayed. And what we have to emphasize also is that we want more women power into our society, as they are also a persona of emotion and caretakers. And work-life balance in this modern era has to be shared with life partners and the family members. And indeed, the society needs women, and it needs women to take care of the specialty. So I want more women to come into interventional radiology.
ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೂ. ಇವತ್ತು ನಾವು ಕ್ಲಿನಿಕಲ್ ಇಂಟರ್ವೆನ್ಷನ್ ರೇಡಿಯಾಲಜಿ ಕಾನ್ಫರೆನ್ಸ್ ಅಂತ ಆರಂಭ ಮಾಡಿದ್ದೇವೆ. ಇದು 2ನೇ ಸತಿ ಮಾಡ್ತಾ ಇರೋದು. ಕೋವಿಡ್ ಮುಂಚೆ ಒಂದು ಸತಿ ಮಾಡಿದ್ವಿ. ಪ್ರತಿ 2 ವರ್ಷಕ್ಕೆ ಒಂದ್ಸತಿ ಈ ಥರ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಇದೇನಂದರೆ ಜನರಿಗೆ ಮತ್ತು ನಮ್ಮ ಮೆಡಿಕಲ್ ಫೀಲ್ಡ್ ಅಲ್ಲಿರೋರಿಗೆ ಎಲ್ಲರಿಗೂ ಇದ್ರದ್ದು ನಾಲೆಜ್ ಕೊಡೋಕ್ಕೆ, ಇದ್ರದ್ದು ಎಲ್ಲ ಮಾಹಿತಿ ಎಲ್ಲರಿಗೂ ತಿಳಿಸೋಕ್ಕೆ, ಏನೇನು ನಾವು ಇಂಟರ್ವೆನ್ಷನ್ದಲ್ಲಿ ಏನೇನು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು, ಯಾವ ಥರ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು ಅಂತ ನೀವು ಈಗ ಆಲ್ರೆಡಿ ಸುಮಾರು ಕೇಳಿದ್ದೀರಾ. ಕ್ರಿಸ್ಪ್ ಆಗಿ ಒಂದು 5 ಪಾಯಿಂಟ್ಸ್ ಹೇಳಬೇಕಂದ್ರೆ, ಇದರಲ್ಲಿ ಸ್ಕಾರ್ ಇರಲ್ಲ, ಬ್ಲಡ್ ಲಾಸ್ ಭಾಳ ಕಡಿಮೆ, ಮನೆಗೆ ಅವತ್ತಿನ ದಿವಸನೇ ಹೋಗ್ಬೋದು, ಇಮಿಡಿಯೇಟ್ಲಿ ನೀವು ವರ್ಕ್ ಜಾಯಿನ್ ಮಾಡ್ಬೋದು, ಆಮೇಲೆ ಯಾವುದೂ ಥರ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸು, ಕಾಂಪ್ಲಿಕೇಶನ್ಸು, ಇನ್ಫೆಕ್ಷನ್ಸ್ ಆ ಥರ ಆಗೋದು ಸುಮಾರು ಕಡಿಮೆ ಸರ್ಜರಿಗಿಂತ ಎಲ್ಲ ಬೇರೆ ಟ್ರೀಟ್ಮೆಂಟ್ಗಳಿಂದ. ಒಂದು 2-3 ಉದಾಹರಣೆ ಕೊಡ್ತೇನೆ ಈ ಟ್ರೀಟ್ಮೆಂಟ್ಗಳಿಂದ ಏನು ಮಾಡ್ಬೋದು ಅಂತ. ಒಂದನೇದು ಬಂದ್ಬಿಟ್ಟು ವೆರಿ ಸೆನ್ಸಿಟಿವ್ ಇಶ್ಯೂ. ನಮ್ಮ ಸೊಸೈಟಿದಲ್ಲಿ ಸುಮಾರು ಹೆಣ್ಮಕ್ಳು ಗರ್ಭಕೋಶನ ತೆಗಿಸ್ತಾರೆ ಸರ್ಜರಿ ಮಾಡಿ. ಎಕ್ಸೆಸಿವ್ ಬ್ಲೀಡಿಂಗು, ಪೇನು, ಯೂರಿನೇಷನ್ ಸಿಂಪ್ಟಮ್ಸ್ ಅದರಿಂದೆಲ್ಲ. ಅದೇ ನಾವು ಚಿಕ್ಕ ರಕ್ತನಾಳದ ರಂಧ್ರದಿಂದ ಗರ್ಭಕೋಶದ ಒಳಗಡೆ ಹೋಗ್ಬಿಟ್ಟು ಆ ಗಡ್ಡೆಗಳನ್ನು ನಾವು ಬ್ಲಡ್ ಫ್ಲೋ ಚಾಲನೆಯನ್ನೆಲ್ಲ ಬಂದ್ ಮಾಡಿಬಿಟ್ಟು, ಅದಕ್ಕೆ ಎಂಬಲೈಸೇಷನ್ ಅಂತೇವೆ, ಅದನ್ನು ಮಾಡಿಬಿಟ್ಟು ಅದನ್ನು ಅಲ್ಲೇ ಶ್ರಿಂಕ್ ಮಾಡಿ ಗರ್ಭಕೋಶದ ಕೆಲಸ ಏನಿದೆ, ಅದ್ರದ್ದು ಏನು ಫಂಕ್ಷನ್ ಇದೆ ಅದನ್ನು ನಾವು ಅಲ್ಲೇ ರಿಟೈನ್ ಮಾಡ್ತೇವೆ. ಅಂದರೆ ಗರ್ಭಕೋಶ ಮತ್ತೆ ಅವರು ಪ್ರೆಗ್ನೆಂಟ್ ಆಗೋ ಚಾನ್ಸಸ್ಗಳೂ ಇರುತ್ತೆ. ಆದರೂ ಅವ್ರಿಗೆ ಇರೋ ಸಿಂಪ್ಟಮ್ಸ್, ಪೇನ್, ಬ್ಲೀಡಿಂಗ್ ಅವೆಲ್ಲ ನಾರ್ಮಲೈಸ್ ಆಗುತ್ತೆ, ಗರ್ಭಕೋಶ ಅಲ್ಲೇ ಇರುತ್ತೆ. ಇದೇ ಥರ ಕಾಲಲ್ಲಿ ರಕ್ತನಾಳಗಳು ನಾವೆಲ್ಲ ನೋಡ್ತೇವೆ. ಸುಮಾರು ಜನಗೆ ಉಬ್ಬಿರೋ ರಕ್ತನಾಳಗಳಿರುತ್ತೆ, ಕಾಲಲ್ಲಿ ಗ್ಯಾಂಗ್ರೀನ್ಗಳೆಲ್ಲ ಆಗಿರುತ್ತೆ. ಗ್ಯಾಂಗ್ರೀನ್ ಆಗಿರೋ ಕಾಲುಗಳಲ್ಲಿ ರಕ್ತ ಚಾಲನೆ ಚೆನ್ನಾಗಿರಲ್ಲ. ಅವಾಗ ಅಲ್ಲಿ ಹೋಗಿ ಓಪನ್ ಮಾಡಿ ಆಂಜಿಯೋಪ್ಲಾಸ್ಟಿ, ಸ್ಟೆಂಟಿಂಗ್ ಮಾಡ್ತೇವೆ. ಅದೇ ಥರ ಉಬ್ಬಿರೋ ರಕ್ತನಾಳಗಳಲ್ಲಿ ರಕ್ತನಾಳಗಳು ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ ಕಾಲಲ್ಲಿ. ಆ ರಕ್ತನಾಳಗಳನ್ನು ನಾವು ಒಳಗಡೆ ಪಿನ್ ಹೋಲ್ ಮುಖಾಂತರ ಕಟ್ ಮಾಡಲಾರ್ದಂಗೆ ಹೋಗಿ, ಅದಕ್ಕೆ ವೆರಿಕೋಸ್ ವೇನ್ಸ್ ಅಂತಾರೆ, ಅದನ್ನು ನಾವು ಅಲ್ಲಿ ಅದನ್ನು ಕ್ಲೋಸ್ ಮಾಡ್ತೇವೆ. ಇದು ಒಂದು 2 ಉದಾಹರಣೆ ನಮ್ಮ ಸೈಡಿಂದ. ಥ್ಯಾಂಕ್ ಯು. ಹೇಳಿ.
We are having our second annual.
ಇಂಗ್ಲಿಷ್ ಎಲ್ಲ ಬೇಕಾ?
No, we are having our second annual Clinical Interventional Radiology Conference today under the aegis of ISVAR Karnataka State Chapter, which is a Interventional Radiological Society. Interventional radiology is a super specialty which is available in most of the hospitals these days, particularly in Tier 1 cities. Interventional radiology procedures are performed through a pinhole. We cater to patients with both benign disease and cancer. All the medical specialists do refer the patients to us, and we perform these procedures in conjunction with all the super specialists in the hospital. Significant advantages of interventional radiological procedure is that there is no scar. Procedure is performed through a pinhole. Much quicker recovery compared to any other treatment. No blood loss. Much lesser infection, and the patient goes home very soon after the procedure, like next day or a daycare procedure. It is a super specialty where pinhole procedures are performed, and all the patients should try and utilize these procedures. One of the reason for this conference is to increase the awareness amongst the clinicians and amongst the patients.